Welcome everyone to part 2 of the Guide to the CMS EP Rule Surveyor Training webinar. My name is Ashley Slight. I'm here with my colleague Chris Riccardi. This is part 2 of a webinar, so make sure that if you haven't turned into part 1, you go back and listen to that. We are discussing the surveyor training, and we spent part 1 going into a little bit of detail about the emergency preparedness role, the comprehensive program that surveyors will be looking for, and we went into detail about how to access the surveyor training, so make sure you don't miss that. A quick disclaimer, everyone should access the full surveyor training. If anything, we're doing these webinars to emphasize the importance of the surveyor training and having multiple staff members at your organization take the training, both modules 1 and 2. So this webinar is by no means meant to replace the surveyor training. We really hope you don't come away from this thinking, well, I got the highlights, so I don't need to pay attention to the full thing. But our purpose is really to show you some key areas of focus, maybe elaborate and examine some of the survey procedures that are listed in the course to set you up better for success when you're taking the course. And so with that, I'm going to pass it to my colleague Chris to go through each element of the rule that we have noted as some areas that we can provide subject matter expertise on. At the beginning of each section, we're actually going to list the lesson and the module that we are referencing from the surveyor training. So you'll see in green at the top of each slide following here, lesson 1, module 2, lesson 3, topic 1, for example. So we're directly tying it to the surveyor training, hopefully to help you out a little bit.
Perfect. Greetings all. This is Chris Riccardi. Thank you again for the opportunity to share some information and again, hopefully able to help set you up for success in your roles and in your understanding. So might as well jump right on into this, and this is under Lesson 1, Topic 2 in the Surveyor Training, Program versus a Plan. What does this look like? I've been working with emergency management professionals for the last 15 years or so, and I still run into folks that we deal with a little confusion here. So I don't want you to feel like you're isolated if this does not make sense, but hopefully we'll be able to add some clarity to this. Basically, your emergency management program is the umbrella that fits over the top of many different facets of your emergency management operation, one of which includes your emergency operations plan, and I'll get into that in a moment. But the program is how you manage the process. This includes inventories, your plan writings, your policies and procedures, your business continuity plans or your continuity of operations. This all falls under your program. Your disaster exercises, your tabletops, your meetings and documentations with training. This is all part of your emergency management or your emergency preparedness program. Now, what is your plan? Well, the emergency operations plan should be an operational tool to guide your organization through any disaster process. That plan is the written document that includes the scope of what the plan is written, the different processes that are involved in that plan, incorporating communications, safety and security, your utilities, just to mention a few. You also run into your clinical and support activities. Now, these are tools that need to be incorporated into your emergency operations plan to offer guidance to folks that are working through this process. Because even though you may have written this plan, you may not be available in the event of a disaster. As I had mentioned in the previous webcast, you may be in Guam on vacation when something happens in your facility. How would your facility be able to respond if you are not present? So just so that you understand that when you write these plans, when you put your emergency operations plan in place, make sure you write this for somebody who is not there writing it with you, okay? By having your plan, that's only a small portion, your emergency operations plan is a small portion of the requirement needed to meet this portion of the regulation. Your facility needs a comprehensive program. And again, as I mentioned, that's the umbrella over all of this, and not just a plan that sits on a shelf. And folks, I go into facilities to assist others, and I can tell you when I ask to see that plan that they pull a book off the binder off of a bookshelf and they're blowing dust off. It looks like Raiders of the Lost Ark finding some relic that had been sitting on the shelf. Now, I'm grateful that it was me that found that, as opposed to the surveyor that had come in and found that that's where your plan is. The other issue that I find is that the plans are written in 2010, 2012, so obviously they have not been updated in the time frame in which you need. Now, one of the things that they're looking for with the emergency operations plan is that this gets reviewed, revised, and updated at least annually. So, which nice segue into our review. Again, it needs to happen at least annually. And when you review this, it needs to be documented that it's been reviewed. If you have made any changes to this document, make a notation as to what changes were made. And I say that not because you have to maintain an extra batch of paper, but it'll help demonstrate to your surveyor why you revised this plan. Another example I'll use, and I used this in the past, is if this was a utilities failure, if this was, let's say, a flood in your facility and you have a written plan that would walk step by step through that response, and you find that when you did respond to the actual event, that did not mirror what the written plan had stated. So now you'll go back and implement the practical knowledge you've gleaned and the experience into that plan to make this an operational plan to respond to an event like this. But that information needs to be documented. The dates in which you've changed that needs to be documented. And this gets done at least annually. Even if it's just to review the document and there are no changes, at least make sure that you note that it has been reviewed annually. So we'll get into lesson 1, topic 2, and that's evaluating the potential interruptions. Now, each facility has different risk potential, and it depends on what the physical location of your facility, perhaps the services you provide. But as you start to evaluate these potential interruptions, you need to take into account how long will this last? How long are you able to sustain yourself during the course of this? What services will you be able to provide, and how will you deliver these services in the event of an interruption? Now, this interruption can be wildfires that are causing you to evacuate your facility. You still want to take care of your patient population, but you may need to do that in a different venue. Or how long will you have to be away from your primary facility to be able to maintain this? And how long can you do that, maintaining services from a different location? Now, if this was a wildfire event, which are things that may be a little bit more global, or local flooding, your interruptions are going to be pretty dramatic. But how long can you sustain yourself? What is a realistic time frame for you to be able to sustain this operation? What type of services will you be able to provide? Now, you may not be able to do the dental care that you may have in your facility, but you're still able to deal with prescription processes and writing prescriptions and ensuring that your patients have the appropriate medications available to them. So this is something that I cannot dictate to you, and only you would be able to identify what that would look like. And then, of course, how you would be able to deliver this process and this service to your patient population. If you are at a different location, is there a way for them to get to you? Is there a way for you to communicate to them? And again, as you start getting into this, you want to be able to ensure you have a continuity of care, a continuity of operations during an interruption in services. I mentioned this in the last webcast, and I'll mention it again. 40% of businesses that close due to a disaster event never reopen. Now, you think about what kind of an impact that would have on your organization, what kind of an impact that would have on your staff, what kind of an impact that would have on your patients. So as you make these plans, you start working down that path, please keep these things in mind as you evaluate your potential interruptions. Now, how do you identify these issues?
If I can just add, the surveyors are being trained to evaluate these potential interruptions in the same way that you all are by taking this course. So they're being trained on these elements to evaluate from the outsider's perspective. And they're not only going to look for it in your documents, but they're going to ask your staff about these things. They're going to ask what contracts are in place, how long would the time frame be for that contract. So just think about the surveyor training, think from both perspectives, both from what you need to prepare on your side, but also this is the surveyor being trained on these potential interruptions, and that's what they're going to ask about.
And that's a good point. And again, anytime you put together a plan, remember you have 4 big items to think about. So if you've identified that an earthquake is a risk, have you secured pictures on your wall and dealing with mitigation? Have you strapped your water heater in the facility to a wall so that doesn't overturn and potentially cause a flood, fire, etc.? What kind of preparedness things do you put into place? Your training, your exercises, your tools. How would you respond? You need to practice that response process. And then, of course, getting into your continuity of operations, you deal with your recovery aspect of that as well. So let's get into the survey procedures. As Ashley has mentioned, this is something that the surveyors are taking as well. This is an open book test, folks. You will be versed as well to the same degree that the CMS surveyors are trained in these preparedness rules. In going through this training, the online training, you will have the same information that the CMS surveyors have for you. We highly encourage you, and I cannot emphasize this enough, that you go through step by step of this process to better equip you to have the tools you need to succeed. Okay? So with these survey procedures, this is just a screenshot of they'd be looking for what your surveyors would be looking for with your emergency plan. They're going to ask to see a copy of your facility's emergency preparedness plan. They're going to ask your facility leadership to describe potential hazards that are identified in the risk assessment, including natural, human-induced, facility-based, your geographic issues if you're in a place that may have tsunami risks, such as an example, or types of disasters, and how the facility conducted its risk assessment. Have you included your community partners in this? Have you included the local hospitals in your risk assessment? Have you included the fire department and police department that may have a better understanding of the risks that are in your community? You have these oil pumping stations throughout the cities, and one may be in your backyard, but since you don't live in the same place you work, you may not be aware of that potential hazard that is in your midst. You want to also verify, they will also verify the emergency preparedness plan contains all of the required elements that they're looking for, and they will also verify that the facility reviews and updates the plan annually. They'll be looking for documentation, review dates, and any updates made to that plan based on your review. And folks, your leadership may not have a copy of the plan in front of them when being surveyed or interviewed by the surveyors. So this needs to be managed up, managed down, managed east and west to ensure that everybody has a working knowledge of what those potential risks are to your facility. If it's an earthquake, if it's a fire, if it's a flood, what is the biggest risk? What are the 4 biggest risks that you want to identify? So this one is in dealing with persons at risk. This is lesson 1, topic 3. Now, I'm going to just throw this out there right now that although this is not required in the EP rule for your rural health clinics and nor your federally qualified health centers. So, but I will tell you this. This is a hot button topic in many other facets and many of the other provider types. And you can pretty much rest assured that at some point or another you will be incorporating these at-risk populations into your plans and into your procedures. Now, and many of you may actually have a patient population that have any one of these issues in qualifying them as an at-risk population. Are they able to maintain independence? Communication. And communication is also language barriers, folks. So you may have folks that speak another language that you may need to accommodate in your facility. What about transportation to and from your facility? Do you have access vans for those that may be somewhat immobile? What about, do they need supervision in their care? Do they need somebody to be watching over them while they're going through some of these things? Do they have a caregiver that maintains that care for them? And of course, their medical care. What are the different facets that may need to be incorporated into this? Okay. Again, this is not something that's required for the RHCs or the FQHCs, but I would highly encourage you to start thinking down that path, start planning for your future aspects to ensure that you start moving down this path, because this will have some impact on you in the future.
We see so many clinics and healthcare facilities where this is an issue in actual disasters and incidents. The wildfires that we've had recently, at-risk populations is always one of the key areas of any after-action report. So we highly recommend that you take a look at this and other elements of the surveyor training that maybe they are specific to other facility types, but you got to remember that all of this is based on best practices and lessons learned from real incidents.
And that is a great point. This is your patient population. And even low income is also one of the items identified under at-risk population. So if this is part of your client base, I would highly encourage you to start to incorporate this into your planning processes. So we'll get into standard operating procedures or your operating manual. Lesson 2, topic 1. Now, CMS doesn't specify where the facility should keep this, your emergency operations plan and policies and procedures. But I would highly encourage you to have a couple of copies. One that stays in your emergency operations center or wherever you would manage an event from. And I can't dictate where that is placed in your facility, but that would be one key place to have this, so anybody responding to a disaster will have access to that EOP. Another good place to have a copy of this would be in your, well, one in your office, wherever that may be, and perhaps one in your executive leadership's bookcase, so that they at least know if something happens, they can open up that book and identify what their response may need to be. But they would give them a little global understanding of what this response is supposed to look like. But again, even with the individuals that are in your facility, in your emergency operations center, but the issue that you run into by maintaining more than one copy of this is that when you update one, you need to update all. And that's an item that often gets overlooked, because if these surveyors want to see the manual that is most current and they end up in your executive leadership's office and that one hasn't been, you will be cited for that process, okay? And your policies and procedures can be incorporated into that binder or wherever it is that you keep this. Perhaps you use links to an electronic database of this information so that if you do use something like that, you can update this in one particular location and it is current all the way through and through. But remember, by maintaining links, whether you use an internet or intranet, is that you run the risk, if there is a disaster, of not being able to access that information, okay? So this can be all part of your emergency operations plan or your operating manual, et cetera, but just, and you may call this whatever you need to, but just know that your operating manual does need to contain these items. And you need to demonstrate this to the surveyor, and usually upon their arrival, these are the entry documents that they're looking for you to demonstrate compliance in this fact. So let's get into evacuation and shelter in place. Lesson 2, topic 3. Obviously, this is of key importance. Now, this is where your staff come in and how well your staff have been trained and how well versed they are in their emergency plan. Now, we had spoken in the previous webinar about the fact that your training needs to take place, initial training needs to take place during onboarding, or if you've been there for a while before this had taken place, that you at least have been trained initially, and then this training needs to be maintained at least annually. Now, that includes disaster exercises, et cetera, but there needs to be a comprehensive knowledge for your staff to be able to respond efficiently and effectively during a disaster, with or without guidance. So keep that in mind as you develop these plans, and as you develop that training. And return demonstrations by these folks is crucial as well. The surveyors will interview your staff about the specifics for evacuation. such as how would they get out, how would they move their patients out of a facility, how do you prioritize your patients for evacuation. These are all key components to your evacuation process. Now, what about sheltering in place? This is another little curveball that we get into, and this is how would you be able to secure your facility in the event of a potential disaster outside? Maybe there's an active shooter running the streets, you need to lock down, or perhaps it's a toxic chemical that has been released out into the community that you need to shut down air handlers and lock down your facility to ensure folks are not able to, well, that you have to provide them with egress, but that they are at least in a safe environment if in fact that does take place. Now, your volunteers, vendors, and other staff. Now, this is very clearly indicated that anybody that enters your facility needs to have a knowledge of your work, of your plan. And that includes your vendors, if they are on your site, anybody having construction done in your facilities. Your construction personnel also need to know how to respond appropriately. Maybe you use a colored code. The state had adopted a standardized color codes for facilities. So if you're using color codes, is your code red a fire? Is your code orange a hazmat spill? I don't know, but again, whatever that is, you need to train the individuals that will be in your facility. Now, this includes per diem staff. Maybe you have contracted staff that come in that you are using. Maybe you brought staff in from another facility that are assisting you. Do you maintain the same codes in the other facilities, in your sister facilities, under that organizational header? These are, again, key components that need to be identified. And I would highly encourage you, if you have more than one facility under your purview, that you standardize as much of this as possible. It'll help you to keep your sanity. You can then cross-facility train other facilities, other staff as well. Okay? And note the specifics that you're going to need for the individuals that you're working with. Contractors may have a need, but your contractors would also be able to assist you with checking for your facility if it's seismically sound after an earthquake. So think a little outside the box. Think about how you can utilize these services with the volunteers as well, as to how to integrate them into your process. We'll get into waivers. Now, again, your 1135 waiver is something that's in place, so if you need to move to another location, that you're able to get this waiver to ensure that you're still able to bill Medicare, Medicaid in the event of a disruption in service. But again, I would highly encourage you to include the verbiage in your emergency operations plan as to how you would obtain a waiver, even though this, again, is not directly applicable to an RHC or an FQHC in the rule. It would be very relevant to you nonetheless. We've had some experiences shared with us at the CPCA conference just about a month ago, that demonstrated how a facility had to evacuate and the hoops that had to be jumped through to be able to continue services in a different location. So even though this is not directly affecting you per the CMS rule, I would highly encourage you to start to work down that path as to how you would obtain this 1135 waiver and what that process would look like, because again, you're in Guam right now during a disaster response, and your leadership now need to get their hands on an 1135 waiver. Hopefully you put that process in play.
And you should really have your staff trained on waivers, even if it's not necessarily required for RHC, FQHCs. That's one element that's going to be one of the most useful for your staff when something does happen, if they can start getting that process started for you. That'll really help you out in an incident response. So include that in your training, include it in your plan, include it in overall your entire program and assessment of the types of staffing you're going to need in an incident.
And one of the tools that I use during tabletop exercises or actual larger exercises, full scale or functional, is utilizing our emergency operations plan to guide the steps of my leaders working through that process. Because you'll find by doing stuff along those lines, you'll find that your leaders need a little bit more information or maybe a little less information in that plan to help guide their steps. But you know, when it comes to guiding through some of this stuff, having that information at the time it's needed is paramount in responding effectively. So let's get into reviews and updates, and this is Lesson 3, Topic 1. Your surveyors will look for evidence of facility reviews and updates, so ensure that these are documented. Folks, they will look for this. They need to ensure. Now, maybe your plan that you utilize, you just change the footer, the date on that footer that reflects that you've just done this particular calendar year. But you also need a documentation page to demonstrate what's been done, when it was done, and the changes, revisions that have been made accordingly. Also listed on there needs to be the individual of whose job it is to do these updates. Usually your emergency preparedness leader would be that individual. The date of the reviews, the date of the approval, perhaps you use an environment of care team or a committee that you get your documents approved through. But again, this is where that process takes place. Now, one of the best practices that I found is that every January, review all of your documents that need to be reviewed for that calendar year. Just make it a good habit, good practice to do this every January for that calendar year. It gets you in a good habit. It gets you in a good practice of being able to ensure that all of those documents are done one fell swoop. Maybe a little arduous in January, but you're also in a good place if, in fact, you have to demonstrate the revisions. Because if you have your emergency operations plan that needs to be revised in March, your HVA that needs to be revised in July, perhaps your policies and procedures that need to be done in February, you're going to need to be able to work your way through that. So make sure you document that, and again, the short description of those changes. So HIPAA, now this is, again, another interesting little dynamic, because with your privacy issues, you can, according to CMS, transmit this information electronically. Okay, the info can be shared electronically, and it's not specified as to how by CMS, but it is your responsibility and the receiving facility of this information to maintain patient confidentiality, that this information is not being able to be broadcast out nor obtained by anyone outside of the healthcare organization. Your HIPAA is going to be crucial, and you definitely need to identify how you would transmit this information. Perhaps you're on a ReadyNet system that you're able to work through a closed network where you can move information back and forth, or perhaps you're working with another service provider, that you have a safe pathway to transmit information clearly.
And make sure that you pay attention to this portion of the surveyor training especially, because knowing what the surveyors are being taught about HIPAA and what to look for will help prepare you for those questions, not only from the surveyor, but from your staff about HIPAA in a disaster. It is a gray area, and I know for a lot of facilities it's a big question in everyone's mind. So pay attention to that portion of the training, Lesson 3, Topic 2, and really understand what the surveyors are being told.
Training and testing, I had covered most of this as we were going along, but make sure that you go through your initial training phases, that you cover this annually, and this is covered under Lesson 4, Topics 1 and 2. Your new staff, and include your per diem folks if you do utilize per diem staff, that they go through this training as well. And it contains the specific training recommendations for the facility types in your particular environment.
Yeah, the surveyor training does a good job of outlining what they think the training will look like at different facility types. And they even have recommendations for providers in this element of the surveyor training. So make sure you take a look at it.
And I think you'll find that, again, time well spent. May be arduous, but it'll be time well spent. Go back in with our training and testing is your annual exercise requirement. Now, you know you need a community-based exercise, a functional plus a tabletop exercise that you can test your plans and processes within your facilities. And your after-action reports, as you write these up, and again, this is the role, however this is assigned, but usually under your emergency preparedness leader. When you document your exercise, what was supposed to happen needs to be denoted, what did happen, what went well, what are the areas of opportunity of improvement, and a timeline for when those improvements will be implemented. not only a timeline, but who is the responsible party for ensuring that those improvements have been made and integrated into your process, which will then get you back to reviewing and revising your emergency operations plan, et cetera, et cetera. This, you see, I hope you're starting to see how cohesive this all is and how intertwined all of these functions are. These don't just fall under a header, but are under your emergency management program.
That's why it really started with program versus plan. You need to show that all these components are linked, they're related, and they all are based off each other.
Now, one other thing, and that is that CMS does not expect you to conduct a complete full-scale exercise as defined by FEMA or the Department of Health Services with the Homeland Security Exercise Evaluation Program. But remember that many of your local communities and collaborators will use the HC model. You can tailor that to fit your need. It doesn't need to be as frightening looking and frightening to complete if you just pick the pieces out that you need of that operation, and it keeps your reporting on a standardized basis, and it would help fit into your coalition's process if you're following similar pathways. Your integrated healthcare system standards. Now, CMS is totally supportive of integrated health system and integrating your plans, but you must demonstrate in each facility that has its own CN or your Medicare number that you have a plan, and each one of these components is maintained at each one of these facilities. If it has a separate number, it needs a separate plan. It needs a separate HVA. It needs separate policies and procedures. Now, you can have an overarching plan that is what your executives would utilize from the corporate level, but you also need to make sure that at street level, so to speak, that each one of these has all of the items that are required by CMS in place at each facility. I cannot emphasize that enough. Don't get into the thought processes that our corporate level has the overarching plan, so I don't need anything. That is, nothing could be further from the truth, and you'll find yourself in a heap of trouble if you don't stay diligent on that as well. And each facility must demonstrate their active participation in the development and the updates, and again, must make sure that you have your documented facility specifics and, of course, your after-action reports. So, a few recommendations. Have a number of your staff, as Ashley had mentioned, undergo the Surveyor training and to generate buy-in and internal knowledge of the requirements.
Make sure that you kind of create some quizzes for your staff. We recommend using staff meetings. It's a great opportunity to maybe go through some of the elements of the Surveyor training. You could print off those survey procedure slides and have those as quiz questions for your staff or for your executive leadership at one of their meetings. Or just about your general emergency management policies and procedures. That'll really help you to identify where your staff needs more knowledge.
No question. Those quizzes have been a huge tool in training staff in the hospitals and in where you're dealing with, you have a whole lot more moving targets to identify their basic knowledge. And those quizzes will also help you to identify how to focus your training in the year to come or the years to come if you have a multi-year training program, so that you can then start to identify where you should focus your attention in training that staff moving forward. Another key thing here is ensure that your executive leadership is more than just a signature in your emergency operations plan, but are actively engaged in this process, and that it'll help them to have a working knowledge of how broad and your role is in dealing with these CMS compliance factors.
And the Surveyor training itself, we know it's long, we know it may be arduous to go through, but go through the entire training with an eye for the comprehensive program that you're putting together. I wouldn't just highlight or tab the areas that are only relevant to FQHCs, RHCs. As we mentioned, these are all best on base practices in the field, and something that might not be a requirement for you now, it doesn't mean a year or two from now it won't be another requirement for you soon. And you kind of can map out the trends in requirements through the Surveyor training.
And this role has grown over the last 15 years, I assure you, from being able to be validated under accreditation standards to now being more heavily scrutinized by the federal government through the CMS conditions of participation. Statewide, we deal with the California Code of Regulations, with Title 22 in many facilities. And again, these are key components to assisting you on your journey.
So with that, hopefully you found this information helpful, but just remember this does not take the place of the training itself. Our goal was to give you some of our expertise on some of the highlights and examine some of the areas in detail. But we are here as a resource and to show you what to pay attention to, try to help you understand the surveyor's perspective. So if you do have any questions about this or any other EP topics, please don't hesitate to reach out. And otherwise, thank you for your time today. We really wish you all the best in building your programs and getting ready for the day that that surveyor arrives, right, Chris?
Thank you very much for the opportunity. And remember that emergency preparedness is not a competitive sport. Reach out to your peers, reach out to your local community emergency planners. You will find that to be a great resource to you without fear of judgment, but seeking information. And you'll find that your peers will be more than willing to share what they've done to help you on your journey. So thank you again for your time. Thank you again for the privilege of sharing some information with you.